Before, during, and after pregnancy, conversations tend to be all about the new baby. But mental health experts and organizations say it's important to focus on the mom as well. Tatiana Cash is talking about it during Maternal Mental Health Awareness Week this week. Tatiana, this is really important for the moms out there.
Kaylee, yeah, this is a conversation we need to be having because while it's great that new moms and expected moms are just going to have this baby, we need to talk about moms and what's going on. So Allison Kuhr, you're here with me this morning. Good morning to you.
Good morning.
Tell me a little bit about why we're even celebrating this week. Because, I mean, it's just baby blues. They'll get over it.
I mean, that certainly could be a fact. It could just be baby blues, but there's a whole spectrum. They've come up with a new acronym, or perhaps it's not new, but new to me, called PMADS, perinatal mental. Oh my goodness, I haven't had any coffee this morning. Anyway, there's an umbrella term for perinatal mental health disorders. And we include postpartum depression, postpartum anxiety, postpartum OCD, postpartum psychosis, PTSD. There's many things that sit under this umbrella, and baby blues is kind of adjacent.
Right.
That is something that we move through rather quickly, lasts maybe for the first month, 2 to 4 weeks, and then the symptoms resolve. And then we have these PMADs over here where it is very much consistent. The symptoms don't alleviate with time. You need some specialized treatment to help support yourself through that.
Well, when we have these conversations, sometimes some moms may think, especially if this is our first time doing this, or maybe it's the second time, but it's our first time having these feelings, this is normal, it's wrong to feel this way, and sometimes somebody may tell me, I just need to get over it.
Without a doubt. And that is what is so challenging about even having a discussion about it, is because you don't know how it's going to land. You don't know if I open up about this, how will someone respond to me? And you perhaps have your own feelings of guilt or shame or surprise that you're even having these feelings or these symptoms. So you kind of have to decide for yourself, is this something I'm even willing to share? And obviously, as a mental health therapist over here, I feel like it's really important always to share if you are having distress or discomfort or just these thoughts or feelings that haven't been there before. But I can also appreciate that that's really risky for some people.
So then what do I do as a mom, pregnant, not pregnant, getting to be pregnant maybe for the 50th time? I don't know. What's smart? What's the good thing to do?
I think it's important to have a conversation before the event.
Okay.
And sometimes we can't predict. We have people who deliver early, we have negative outcomes that occur where the pregnancy doesn't continue. So maybe you don't have the chance to have that kind of conversation before an event occurs. However, if you can do your very best to have a conversation with your support system, to know, hey, like if you notice something going on, it's okay to ask me about it, and to also know your risk factors. If you have a history of mental health concerns, if you have a family history, if you have negative outcomes previously, it's just good to be aware, and then to say, this could happen again, or this could happen to me, and how are we going to address that?
I like this. Let's continue having this conversation. And actually, if you have any questions yourselves, you are able to send them in. Go ahead and head up to our Facebook, head to my Instagram page. Whatever it is, ask these questions. Allison is here to answer them. We'll be back a little bit later on in the show. But for now, I'm going to send it back to you guys in the studio. Tatiana Cash, WTOL 11.